We want to welcome Cynthia Quattro. She spoke to us before. She always has incredible topics that she wants to speak about. Cynthia Quattro is a physician's associate and a doctor of acupuncture and oriental medicine. Dr. Quattro has been practicing integrative medicine for more than 25 years at medical centers in New York, San Francisco, and currently has a family practice in Santa Cruz, and her new location now in Los Altos, California. Her practice specializes in hormone balancing, the treatment of chronic diseases, including Lyme's disease, detoxification, and longevity. She recommends the combination of Western medical treatments, nutrition, plus Oriental medicine therapies, including Japanese-style acupuncture. Dr. Quattro has been a radio guest person on programs such as Lena Berman's and Your Own Health and Fitness. Cynthia has published articles in acupuncture and medical journals and is currently writing a book on treatments of medical conditions using Western and Oriental medicines and methods. Let's give Cynthia a big welcome here, and she can tell you all about it. Thank you.
Hello, everyone. See if the equipment's working. Yes. Okay. Good. Okay. Hello and good evening. It's nice to be here again at one of the best health forums I think there is. Thanks to all of you who make it happen, and thanks for everyone for doing all that you do, and thanks for inviting me. So I'm the person that's presenting the short program. I found that it's usually easier to present, to prepare for a longer program than it is for a shorter program, especially if you're covering a topic as interesting as the mind. The mind, keeping it sound. I chose this topic because the mind is a precious thing, and there's never been as much strain on one body part as it is now since we have the surge in electronic media. In terms of the body and brain, there are many theories about what makes a good mind or a sound mind, but actually there's no justified means or standards of measuring it. For most conditions, we can look at a blood test, look at your kidney function, your liver function, do tests to see how it's working. But for the mind, there really aren't any tests. There's no real standard as far as routine tests. So we speculate on how can it be judged. Can it be based on how good your memory is, or what your level of your IQ is, or what your emotional IQ is, or can it be judged on how smart you are in one particular area of interest? But there's also a pervading thought that if you have a smart mind, you have a sound mind, and you will go further. One theory suggests that whatever you were born with is what you get, and that the ability of your mind is solely related to your genetics, and somehow your destiny is a fixed phenomena based on the quality of your mind. As time has evolved, it's now better understood that there are a number of reasons why the mind may not function well enough to succeed or even function at all. And keeping aside emotional illnesses, which is another complex subject, today I just want to briefly look at the medical model and what impacts the brain, the mind, including, for example, environmental exposures that can affect the brain due to its toxicity, and also how traumatic brain injury can change a person's mind and their life's course in an instant or over a period of time in the case of chronic injury, such as that occurs when you're playing some of the most common sports today, such as American football and boxing. And so there is a growing amount of research looking at the genetics and how it influences the mind's health. It is, in fact, that one of us is born with a mix of chromosomes, that we are born with a mix of chromosomes which predetermine certain things, such as our hair and eye color, skin tone, color, height, and these we can't change. But it's more interesting to note that some genetic markers referred to as SNPs, these single nucleotide proteins, are more variable. At the bottom of the slide are a few of the more common ones that we can measure. For instance, the MTHFR which involves a folic acid cycle, which influences many organ systems, including the cardiovascular system and the brain, and moods in particular, and also the cytochrome P450 enzymes, which have to do with your liver detoxification, not only your ability to detoxify or metabolize drugs, but also how well you can handle exposures to toxins such as heavy metals, things like that. And also the ApoE4. And this is one that's involved in lipid metabolism, which also influences the fuel for the brain. So we'll talk a little bit more about that. And these SNPs, or DNA sequences, they are DNA sequences, and they can be influenced by adverse health conditions and exposures, or they can be influenced by supportive nutrients. So that means if one of these markers or conditions you have, like depression or high cholesterol, that is indicated by one of these SNPs, that by using targeted nutrition and beneficial therapies, you can block the full expression of that gene or disease manifestation. So it seems remarkable that we can have this kind of influence on our destiny, on the destiny of our health. But still, most people don't know this is possible, including most of the medical community. In a primetime address, President Bush said that he backed limited federal funding for stem cell research. That's right, he said, and this is his quote, the research could help cure brain disease like Alzheimer's, Parkinson's, or whatever it is that I have. So stem cell research is proving to be one of the most revealing and effective links to treating some of the most serious degenerative conditions affecting the brain. And there's limited access to this kind of treatment, but it is spreading. And one area that's getting a lot of attention is research in treating Alzheimer's disease. And Alzheimer's disease has become a household word. Every time we lose our keys, we say to ourselves, are we getting Alzheimer's? Or if we forget someone's name immediately after being introduced to them, which I do often, we feel like we're losing our mind. But of course, in reality, this happens to all of us, at least occasionally, and sometimes we call it a senior moment or some kind of excuse that we use for it. But the pathology actually involves a negatively charged protein they call the tau protein. And this is what builds up on the neuron and eventually can become tangled with other proteins. And eventually it can make these plaques, what we call the amyloid plaques. There's also the inflammatory effects that can occur in brain degeneration and oxidative stress that occurs and affects the brain. And I put up one visual slide. I don't know how well it turned out, but well, you can sort of see it there, but basically the loss of healthy neurons and the loss of synapses is what leads to cognitive decline. And healthy neurons, which if the slide was clear, you could see at the top of the image, they have this, they provide this internal support structure called the microtubules. And so essentially what they're doing is they're creating form for the tissue, so they can guide nutrients and molecules through that protein into the neuron so then the neuron can do its job, such as synapsing and making the brain work well. When there's a disease, this system degenerates, and so then there isn't any more structure to provide the guide for the nutrients for the brain. And this occurs of course, in Alzheimer's disease. And also, it's been found to occur with other conditions, such as chronic brain trauma, as well as things that we'll talk about later, which is some of the prions or bacterias. And so you can see in the other slide, as the brain does atrophy, it will shrink and the ventricles will widen. And it'll look something like that on an autopsy. Okay. The genetic marker that's most commonly associated with Alzheimer's disease is the apolipoprotein E4, mainly because it's associated with the transportation of fat into the brain for its nutrition and its synapse accuracy. And if there's a genetic malfunction, the transportation of fat is impaired, and the brain likes fat. And although there is some speculation that many have to do more with the feedback mechanism, that suppresses the production of amyloid. In other words, this gene is being looked at to see if it has more to do with this feedback mechanism that causes the amyloid buildup. So in autopsies, it's been shown that patients with 1 or 2 copies of the ApoE4 allele tend to have more amyloid plaques. And we can measure this as one of the genetic markers in blood tests. So newer research is looking at these gene markers called presenilin 1 and 2, and they're associated with the increased production of amyloid plaque as well. And some of you may know of Susan Boyle, the woman who sang her way into stardom in Britain a few years ago. Brain trauma is a condition that's been getting a lot of attention since so many active soldiers are being affected by it. But still too often the medical community diagnoses and medicates patients for conditions like depression or even psychosis before evaluating them for a brain degenerative condition like brain trauma that can cause the same symptoms. And these symptoms, such as cognitive impairment, behavioral issues, or emotional problems, can be seen in someone with Alzheimer's disease or brain trauma or degenerative brain disease. And a common event which occurs sometimes when someone comes to the doctor, they may have these physical symptoms, and they may have 2 or 3 of these different symptoms, very common symptoms. And the doctor will oftentimes give them 2 or 3 different medications to treat each of these separate medical conditions. And so then the patient's taking these 2 or 3 different medications indefinitely, not knowing when to stop or if their condition's any better, or even what the source of the symptom actually is. So, for example, in my practice, I've seen some of my Lyme patients who have been on long-term antibiotics for quite a while. And after I do an in-depth medical history, which is the only way you can find out if they've had medical trauma or brain trauma, I find that they report several incidents of brain trauma and find that perhaps this trauma has more to do with their condition than the Lyme itself. So there was an interesting article in last month's Science magazine that showed that prions, which are proteins caused by infectious agents, can cause the same degenerative changes in the brain that occurs with Alzheimer's disease and in traumatic brain injury. So we call this the chronic traumatic encephalopathy is a way we refer to it sometimes. So some of these are more common, such as mad cow disease, ALS, and they can lead to rapid death. But research is now finding that this type of brain degenerative condition can be caused by other pathogens, including Lyme disease bacteria, but at a much slower rate. So then we could look at adverse environmental influences, which are an ongoing concern for the brain. And high levels of heavy metals, tend to be stored in the brain and impact the brain function. And some of these, like mercury, can be transmitted from the mother to the baby. Of course, there's some food additives that can also create brain toxicity as well. And I'm constantly learning new sources of exposure to environmental toxins, and I sort of realized just lately that essentially lead is just raining down on us, considering that jet fuel is still leaded. There are well-known studies showing testosterone improves brain function and mood, partially by raising dopamine levels, but more recently there's cumulative evidence that supports bioidentical estrogen as having a significant impact on brain stability. And it does such things as having receptors on the, I'll read it from here. Oh, here we go. There we go. Having receptors to prevent neurodegeneration, affecting the mood and memory. It also influences some of the neurotransmitters, and it has protective and reduces the amyloid beta plaque formation, and it's been found to also increase nitric oxide, which is going to help increase as we were talking about earlier, getting the brain circulation to the brain. This is a research study that hasn't been completed yet. It's called the KEEP study, and it's a cognitive and affective study looking at estrogen, or estradiol specifically. So let's consider what we can do to nurture our brain and our mind power. These are 5 main areas of nutritional support for the brain and the mind. And initially, the nutrients to support methylation, which we probably all know some of those and are probably taking many of those, are essential. And without this system working first, many other nutrients are not going to be effective. And these include the B6 or the precursor, the P5P, the pyridoxal 5-phosphate, the B12, which preferably a methylcobalamin, and the folic acid, and particularly the MTHFR form. SAMe can be helpful in that sense as well. Also, the brain likes good fat, so we need to feed it good fat, the omega-3s. There's a variety of sources of that, but most people take fish oil. Although now we have the krill oil and even walnut oil and hemp oil to provide some omega-3s. And the phosphatidylcholine and serine are particularly helpful, and acetyl L-carnitine. Then there's the neurotransmitter regulation, and there's nutrients for that, such as theanine, GABA, tryptophan. There are others of all these categories. I'm just listing some of the main ones. And antioxidants that are essential for the brain health, such as vitamin E and ginkgo and melatonin has been known to be a good antioxidant. And I think what's probably ignored the most is the blood flow all over the body, and especially to the brain. So I think essentially all of us need to be using something that does thin the blood and increase its flow. Nattokinase is popular. Boluque, the earthworm enzyme lumbrokinase, is very effective, and L-arginine. And and all of these are important, but above all, the ultimate goal is to maintain the neuroplasticity of the brain. And there are many ways to exercise the brain. Learning a new language is commonly suggested, as well as puzzles and games and memorizing songs. And I've included a few resources here for more information about the brain and how to keep it supple. And thanks for your attention. Actually over there. I have some, they're blue. They're sort of behind that electronic thing that looks interesting. But that's where my cards are, if anyone wants to look at my website. Okay.
Questions? Yes, sir.
I read a book recently called The Other Brain about all kinds of glial cells and the support network behind the brain, and that these cells either communicate back and forth with each other chemically, though not electrically, and are a big part of the brain. And you mentioned tubules, which may be related to that, but can you comment about the glial cells and their relationships to pathologies? Are you familiar with this work?
I'm not really a pathologist, so I probably can't really relate directly to those cells in particular, but I'm sure somebody else might. Like I said, these. Mm-hmm.
You want to talk about glial cells?
Oh, I don't need the mic, I don't think.
Okay. Let's take the glial cells, though. Are we still on glial cells?
Well, the stuff on glial cells is very recent, and I think there's a lot to it, but we don't know the answers yet. But it's very recent stuff. I mean, it turns out that some people think that the neurons are just kind of like the road system, and the real action occurs in the glial cells, which is more like the city. And then and so we've been supposing that the leading nerve cells are the neurons, which are these long things, which are just like roads. But people are saying that it's mostly the glial cells. Now, anybody have anything to add to that? Okay, Mr. Lack.
Yeah, you were mentioning about people on the webcast can hear it. Give them the mic, please.
Okay, sure.
Cynthia, you were mentioning about lead, for instance, from which is something I think most people don't even think about in the fuel. Now, oftentimes I'm seeing planes with all kinds of leaving, crisscrossing trails and which look like smoke jets or something. Do you think that there's also some kind of heavy metals in those kind of trails that these planes are flying over?
We know they're toxic.
Because I'm curious if there's some aluminum, you know, in the, just.
Because a family member of mine had Alzheimer's disease, I did a little research and discovered that the beta amyloid plaque probably or possibly arises in the amylase, which is an enzyme of the liver. And I did some research on the internet because I take metformin to reduce the manufacture of sugar in the liver. And it turns out that there is now some research going on that may indicate that the metformin that I'm taking may actually retard or prevent Alzheimer's disease. Have you read anything about that?
No, I haven't.
Well, it's on the internet, so you can follow it up and look it up. But it's a very interesting thing, and I just wanted to pass that along.
The problem with metformin.
Wait, Bert. Yeah, I guess somebody else.
Yeah.
Yes, ma'am.
I went to a conference with the leading experts in Alzheimer's, and basically they're looking at sugar and it being a pre-diabetic condition. So pretty much if you end up getting diabetes and it's not treated, the likelihood of it developing into Alzheimer's is about 86%, which is quite high.
Would you repeat that?
If diabetes is untreated,
Is what untreated?
untreated, like
Untreated.
if the person
Sorry,
is not
okay.
on metformin, so they discover that they've got diabetes after they've found out that they've got Alzheimer's, and they then conclude that it's an 86% linkage.
Well, you know, there's a lot of people who think that Alzheimer's, or at least the brain dementia, including Alzheimer's, is a problem of energy production caused by a form of diabetes type 3. And anybody who's interested in Alzheimer's should definitely get a hold of Mary Newport's book. And because, you know, it turns out that coconut oil, strange as it seems, I didn't believe it when I first heard it. Coconut oil turns into ketones, which is an alternative fuel for the brain. The brain usually uses only glucose. Can't use fat because fats have a hard time getting across the blood-brain barrier. Usually it uses only sugar, or glucose specifically. And so when you have a type 3 diabetes occurring, the problem, you know, with sugar metabolism in the brain, then you have an energy problem, an energy deficit, and you can't remember things and your brain doesn't work right. But coconut oil, being a medium-chain triglyceride, uniquely turns into ketones, which is an alternative fuel for the brain, usually available only when you starve to death. But with MCTs, the liver immediately turns it into a fuel that the brain can use, and you can see immediate progress, immediate change in scores within 45 minutes. And this is all in Mary Newport's book. So I hope you're all hip to this. We've talked about it several times. Steve and I lectured together on this at the Commonwealth Club, and I spent a long time on it because it seemed so weird to me. I didn't want to recommend it to anybody until I really checked it out, and it's just a breakthrough. And I'll bet you in 5 years, Alzheimer's will be history, and a lot of other dementias too. Right? Bert, do you want to do that? What? The name of the book is, let's see, what's the name of the book? Let me see. Mary Newport. What's it called? Yeah, you won't have any trouble finding it. Mary Newport. Just put Mary Newport plus AD. She's also got a marvelous website with videos. And you know, here's how it happened. She reversed her own husband's AD. And Steve passed threw this out one night, and he had like 3 copies of a paper she had done. I was lucky enough to get one of them, and it blows your mind. So anyway, Brent, do you want to do it?
Also, it's very good for cancer ketones, and you want to use that. Mark Rosenberg in Florida is doing a lot of research in cancer. He's probably the most advanced young oncologist today. And he's using palm oil and MCT and coconut in his cancer by suppressing the way that cancer cells absorb fatty acids. It shifts to ketones, and that means the cancer cell doesn't do well. Metformin, you've got to be careful. I think it's an interesting molecule, but you got to be careful. I have a friend of mine who's a very wealthy man. You guys all know of him. He sold EAS, the company, and he started taking metformin because he's into anti-aging like nobody else. And he's putting his money into where it's going, and he's investing a lot of money. The problem he had was when he took metformin, it suppressed his B12 levels, and it led to Alzheimer's. So you have to be careful because B12 needs to be taken with metformin. Otherwise, it can lead to dementia. So B12.
Okay, Mike says we got to cut it short here. Let's, someone down here? Oh, yeah. Cindy, did you want to say something? By the way, that was a wonderful talk. It was a really wonderful talk. I'm very sorry that you didn't have more time because there's very valuable information in that. And let's see now, did you want to say something else, my dear?
Yeah.
Okay, you get the last word. Is it okay?
No, I was wanting to answer the question.
Okay.
This is my first time coming tonight, and I'm pretty impressed that everyone's taking all these supplements. But I'm curious as to how people are figuring out what supplements to take and what dosages to take. And as a functional medicine practitioner, maybe you could discuss some of the diagnostics you use to figure out how to put somebody on supplements.
You know, unfortunately, it's 8 o'clock and we have to stick to schedule, but Cindy is good. I mean, you know, I've heard, how many speakers do you think I've heard in 20 years at one a month? That's 240 speakers, and you know, she's good. So, you know, I would definitely get her card and look her up because she knows her stuff, I'm telling you. So, thank you very much, Cindy. And I'm sorry we didn't have more chance to hear from you, by the way. I'll tell you later. Okay, now we're going to take a 15-minute break so people can socialize and exchange information. It's part of the whole idea of sharing information, trying to help each other. So enjoy. Thanks.